a scalpel to make a midline incision starting from the eyes and extending to the neck. Pull back the skin with small bulldog clamps to expose the skull and provide a clear surgical field. Apply the topical anesthetic bupivacaine to the skull. Using a dental tool or bone scraper, remove the fascia from the top of the skull. Next, make a mark halfway between bregma and lambda and between the sagittal suture and lateral ridge over the right hemisphere. Place a drop of Loctite glue onto a plastic weigh boat and use side-grasping forceps to dip one of the discs prepared earlier into the glue. Press the disc to the mark made on the skull. Use a needle and syringe to add 1 to 2 drops of the Loctite accelerator to harden the glue. Place a 3 mm outer diameter trephine over the disc and spin clockwise until you have cut through the skull. Check the trephine's progress frequently to avoid drilling too far and breaching the dura. The skull flap should feel loose when pressed lightly. Place a dental tool parallel to the skull's surface and use it to pry up the bone flap. Carefully detach the bone from the skull with forceps. Apply pressure with a cotton applicator to stop any bleeding and prevent bone dust from getting onto the dura. If there is a visible breach in the dura, the animal should be eliminated from the experiment by humane euthanasia. Use forceps to place the hub in a position over the hole such that the bias of the hub aligns with the curvature of the skull. Use a sharp-tipped wooden stick to apply superglue around the edges of the hub with one hand while stabilizing it with the other hand. Take care not to get glue on top of the dura, as this may cause reduction in the force of the injury or induce a rip when the hub is later removed. Mix together cyanoacrylic and dental acrylic in a small paper cup. Use a 1 cc syringe to apply cement around the hub. The cement should cover the bottom 2 mm of the hub as well as the surrounding exposed skull. Fill the hub with sterile saline to keep the dura moist during the recovery phase.